I'm Claire.
And I'm Lizzie, and we're pelvic health physios.
So in today's session, we are going to talk about pelvic girdle pain and back pain in pregnancy. And what we do know is that in the pregnant woman, pelvic girdle pain can occur in approximately 1 in every 5 pregnancies. And the pain can occur in many different places in the pelvis and the low back. So I'm going to use the pelvic model now, and Lizzie is going to demonstrate on herself. So pain can occur at the front of the pelvis in the pubic bone. It can travel across the front of the groin, down the inside of the legs. It can go into the side of the hips. And if we turn the model around, we have 2 very strong joints here with the sacroiliac joints and the lumbar spine or the lower back that stacks upon here. Pain can travel up there into waist level and can be felt around this area. So the pain in pelvic girdle pain usually does not travel below the knee, but the pain can go at the front or the back of the thighs as well. So the actual research is a little bit unsure as to what causes pelvic girdle pain, but what we do know is that we know that the joints and the muscles play an important part in what can go wrong in pregnancy, and we're going to talk about that more in a minute. So when we're looking at the joints, we're thinking that pelvic girdle pain may be caused through uneven load or movement through the pelvis, or through changes to the tummy muscles, the pelvic floor muscles, and the back muscles. But they do know that there are some risk factors in the research as to what causes pelvic girdle pain, or why some women will get it and other women will not. So for example, if you have a history of low back pain or pelvic girdle pain, you may be more likely to get it in pregnancy. Or if you've had a previous injury or trauma to the pelvis. We know that if you have a demanding job with heavy lifting or repeated poor postures and prolonged sitting postures, this may contribute to pelvic girdle pain in pregnancy. We also know that if you have a high body mass index, BMI, before pregnancy or by the end of the pregnancy, you may then experience more pelvic girdle pain. So I'm just going to pass you over to Lizzie to discuss the further changes in pregnancy.
So first of all, we're going to have a chat through the muscles, and then we'll have a chat through the posture. So first of all, let's think of the tummy muscles. So we all know that our tummy muscles are going to stretch and lengthen and take more strain in pregnancy. Down the length of the tummy muscles, from the top of the breastbone all the way down to the pubic bone, you have some strong connective tissue that joins the right side of the tummy muscles with the left side of the tummy muscles. By the 3rd trimester, the end of the pregnancy, this strong connective tissue is ever so slightly starting to widen, and that's very normal to make room for baby to grow, but this in turn will affect the way that the tummy muscles dynamically support and control and give control to the back and to the pelvis. Next, let's think of the pelvic floor muscles. So the pelvic floor is a hammock of muscles that supports the bladder, the vagina, and the back passage. It also gives a lot of support to the pelvis. And at the moment, if you're pregnant, those muscles are going to feel the weight and the strain of baby going down, and this will weaken them slightly. Next, let's think of the buttock muscles. Normally in our everyday activities, in everyday life, we will be walking a lot, we might be going to the gym, we might be going running, we might be chasing around after our toddlers and our children. However, at the moment, your activity levels might have changed ever so slightly, and as we decondition, these buttock muscles will become slightly weaker. So overall, we end up with less dynamic control and support from the tummy muscles, from the pelvic floor muscles, and from the buttock muscles. Next, let's look at the posture. So I'm going to stand up now. As we get more heavily pregnant, the weight of baby pulls us further forwards. This is normal. To compensate for this, pregnant ladies commonly will lean backwards and become more lordotic at the bottom of their spine. As a result of this, though, the back muscles will become tighter. At this point, there's more of an imbalance at the muscles. So some muscles are tighter and some muscles aren't working in the supportive way that they usually would do. This, as well as taking uneven loads through the pelvis, creates more strain, and sometimes we develop more stiffness at our joints as well. So that if you imagine everyday activities, such as getting dressed on one leg, usually as I go to lift up my leg, my buttock muscles, tummy and pelvic floor muscles would give me support, At the moment they're not if you're pregnant, and so you'd feel the pain at the joints instead. When you go to get in and out of the car, as you go to swing your leg and move, usually the muscles will give more dynamic control and support. So at the moment they're not. So you'll feel the strain and hence the pain at the joints instead. So what me and Claire are going to do is throughout a series of different videos, we're going to look at how we can give you some advice on posture, on pelvic floor muscle exercises, gym and mat-based exercises, and some everyday activities to try and help you cope and to try and help you manage. And the really good news is that by the time that baby's 6 weeks old, 94% of people find that their pain has gone.